Hi there, I'm Dr. Baker. What brings you to
Hi.
see us today?
Well, I have some palpitations. It feels like my heart is racing.
Okay. I saw that it was a little bit elevated on the monitor, like 185. Have you ever had anything like this before in the past?
Once before.
Okay. And did it get better, or did you do anything or take any medications for it?
Well, I came to the hospital, but it kind of got better on my way in, so I didn't find a whole lot.
Okay. I'm going to ask you some more questions, but in the meantime, can you go ahead and take a deep breath and try to hold it for me? Just bear down. Okay. It doesn't look like it slowed down much. Um, I'm going to go ahead and get a brief history and then we'll get some medications to slow that down. Are you having any chest pain?
No, just the discomfort. I can feel it in my chest, but I wouldn't call it pain.
Okay. Any shortness of breath?
No.
Any nausea?
No,
Any belly pain, leg swelling?
not that I've noticed.
Okay. And are you allergic to anything?
No.
Do you take any home meds?
I take baby aspirin, and that's about it.
Did you take it today?
I haven't had it
Okay. Any alcohol, smoking, or drugs?
yet. I drink on weekends sometimes, just socially, not every weekend. Occasionally when I get home after a hard day at work.
Okay. Do you have a hard day at work every day?
Most of
Okay.
it. No, I don't smoke.
Okay.
I smoked 20 years ago. I quit.
Okay. All right. Well, if you can, I'm going to just talk to my scribe here for a second. If you can go ahead and put in for 20 milligrams of cardizem, and we'll get that started to see if we can get that heart rate slowed down a little bit. Do an exam here. His heart is irregularly irregular and rapid. The rate of 185 is on the monitor. Go ahead and lean forward, please. Deep breath. Deep breath. He does have some rales at bilateral bases and some crackles on the right upper. And the liver does feel slightly enlarged, about 2 finger breadths below the right costal margin. And he does have a little hepatojugular reflux. And +1 pitting edema bilaterally. Looks like he's also got a little bit of sclera icterus. Let's go ahead and get some labs put in. If you could put in for a CBC, basic metabolic profile, some liver function tests. Go ahead and get an INR too, EKG, and a chest x-ray, and I think we'll go ahead and just check a troponin. I may go get a bedside ultrasound and just take a look at your heart and make sure you don't have pericardial effusion or anything as well. And also, let's get a magnesium level. Do you have any questions, sir?
What do you think is going on?
Well, right now your heart's going really fast, and so we need to get that slowed down. It could be that you have an electrolyte abnormality. I'm concerned with the drinking that could sometimes cause a shift. With your heart beating fast, it may not be pumping blood as well as it needs to be throughout your body. It could be backing up into your lungs a little bit. And with it being irregular, we need to kind of find out why. In fact, that reminds me, let's go ahead and get a TSH as well, if you could add that.
Am I having a heart attack?
I don't think that you're having a heart attack. I think you're having an arrhythmia. So I think your heart rate is irregular. It looks like you may be in atrial fibrillation with a rapid ventricular rate. And so what we need to do first is slow that down and see if we can get that back to a normal rate so that we can perfuse blood throughout your body.
Okay.
So we'll need to keep him on the monitor and keep checking his vital signs.
Okay.
Let me know if you have any chest pain or if anything changes. All right, it looks like we've got those orders going, and I just wanted to take some more time now that we've got that started to ask a few more questions. Have you had any recent illnesses?
I've been having a cough for the last 5-6 days or so.
Okay. Is it producing anything?
A little bit of sputum, a little bit of
What color is it?
greenish.
Okay. And have you been around anyone else who's been sick?
My wife had a cold a week ago,
Okay.
so we kind of thought maybe she gave it to me.
Okay. Have you had a fever?
I haven't taken my temperature, but I felt one.
Okay. Have you been having any night sweats?
I wake up at night sometimes and have to kick the covers off.
Okay.
I guess feel kind of hot and sweaty.
Any facial pain, nasal congestion?
No, it's really all been in here.
No sore throat or
Nope.
no belly pain?
No, well, I get some belly pain every once in a while. But that's nothing new.
Okay. What's that caused from? Do you have a...
I haven't really seen anybody for it. It's just, usually I have to just wait it out and it goes away eventually.
Okay. Is there anything that makes it better or worse?
I've tried some Pepto-Bismol sometimes, and I can't really tell if it helps or not.
Do you take that regularly?
No, just when it gets really bad, I feel like I have to try something.
Okay. Have you had any blood in your stool?
I've had some red streaks every once in a while. Nothing, not a lot of really.
Anything recently?
I don't remember, maybe in the last couple of weeks once.
Okay. Any belly pain today?
I didn't pay attention. I think I always have a little low-grade pain. Yeah, I guess it hurts a little, but nothing to do anything about it.
Okay. And any leg swelling?
Sometimes, the socks will leave a little bit of indentation or something.
Okay. Any
I
pain
figure it's just part of growing old.
more than one leg than the other?
Oh.
Recent travel, recent surgery, anything like that?
Drove to Kentucky last weekend. Got together with some family.
Okay. And how many hours of the drive is that?
4 each way.
Okay. Any history of bleeding or clotting disorders? DVT, PE, anything like that?
What's PE?
That's a blood clot in the lungs, a blood clot in the legs.
No.
All right. Well, we're just waiting for those test results to come back. Thanks. If you think of anything else, let me know.
Okay.